and welcome to What the Fuck is Going On. So, I appreciate I haven't uploaded in ages, and part of that is because I've actually started university. So, at the moment, I've almost finished my second year. I appreciate my account name is Philosophy Girl, but I actually chose to study psychology in the end. I think there are quite a lot of overlaps, luckily, with the two subjects, and I think I'm still going to be able to include a lot of topics related to philosophy as well as psychology in the future now that I've kind of properly learned a bit more about kind of various theories and conceptions about, human consciousness and stuff. So I'm actually going to read an essay that I wrote for university. I'll probably paraphrase a little bit of it, but hopefully the format is okay. I might change kind of how I do these things in the future. But for now, I thought I'd just try and use this because I've got all my references and kind of the evidence that I've got to back up the stuff that I'm saying, which I can add in the description and will be kind of linked below if you guys want to have a look at the background research that informed this stuff. But so today I'm going to be talking about, and the kind of focus of the essay that I'm reading from was Bronfenbrenners Ecological Model, which is kind of basically a way in which to look at someone's environment and the way that their environment can kind of shape certain outcomes in their life. So in this essay that I'm reading from, I was given a hypothetical case study about an individual named John who was from a kind of deprived socioeconomic area, which is basically the polite way of saying, from somewhere that is kind of slightly poor. And I used Bronfenbrenners Ecological Model as a way to analyze the various external and environmental factors that might impact his health outcomes. So basically his kind of well-being, physical and mental well-being. So Bronfenbrenners Ecological Model was created as an attempt to kind of balance mainstream conceptions about an individual's development. Bronfenbrenner believed more attention needs to be given to the external contextual factors of an individual's life. So rather than purely focusing on internal makeup of an individual, Bronfenbrenner advocated for investigation into that person's environment, as well as investigation into the interactions between the individual and their external world. His model consists of various structures surrounding the individual who's at the centre. Each structure or system consists of different elements of that person's life, from immediate relationships within what he calls the microsystem to more abstract and secondary influences like political or economic factors in what he calls the exosystem. So I will make a quick personal note that I think the technical way in which he's labelled different factors in this person's life can be a bit confusing, but if you're not here to kind of learn the real technical psychological concepts behind it, then you kind of don't really need to pay attention to those labels. It's more about kind of the concepts that I'll be talking about that are the most important. So in this case, the person who we are kind of focusing this case study around, he has diabetes, just to give a bit of context there. So this case study of John, his diabetes, will be examined through the contextual lens of Bronfenbrenner's model to address the environmental and contextual factors that may influence his health behaviours. So within Bronfenbrenner's model, the first structure surrounding the individual is called the microsystem, and it contains the relationships between an individual and their immediate environment. So example of this would be John's relationship with doctors or healthcare providers. So there's a lot of evidence to suggest that negative patient experiences with doctors really discourages people from engaging with healthcare providers. And our willingness to attend or reach out to healthcare providers can have really serious implications for the diagnosis and management of health issues, particularly in cases where people have diabetes and things that kind of require long-term management and like regular use of certain medications. So a lot of the time, people in that situation, they do need a lot of guidance and help, kind of clear communication from the doctors about how to use these things and how to incorporate those habits into their life. And if people don't have positive relationships and kind of opinions of these institutions and don't have positive conceptions about going to the doctor and getting that help, it can have really, really negative implications because that person doesn't establish that positive relationship and they don't have that person or that support there because, they've had negative experiences. Stigma surrounding obesity has also been shown to negatively impact the doctor-patient relationship of people with diabetes. So a lot of research has shown that 40 to 60% of people who have type 2 diabetes report experiencing weight-related stigma in a healthcare setting. And the implications of this, are quite significant because there's a lot of evidence that a poor rapport with health practitioners can influence someone's willingness to kind of engage with those services. If you feel like someone's kind of judging you, if you don't feel comfortable, if you feel embarrassed, it's quite hard to have like quite a vulnerable, open relationship with that person, which is kind of what you need to when they're helping you manage like, very important stuff in your life. And another example of the microsystem would be John's personality and his perceptions about health behaviors, which is kind of just a posh psychological term for doing things that either help or negatively impact kind of your health. So like, eating loads of chocolate, etc. So a lot of people have argued that men in Western societies tend to be raised to not make a fuss about health issues. A lot of people would say this, does have a big impact on men's abilities to engage with services and willingness to honestly communicate their difficulties. Some people contend that due to the impact of gender-related perceptions on personality traits like vulnerability and openness, women and men can have quite different experiences and respond to chronic illness quite differently. Some argue that men are more likely to experience identity dilemmas due to the contradictory nature of identifying with concepts such as masculine strength, whilst being exposed to the vulnerability associated with experiencing long-term illness. This in turn can impact their mental health and ability to recontextualize their identity to properly manage health behaviors. So the next kind of section or structure within Bronfenbrenners model is the mesosystem. This consists of the interactions between the immediate relationships and settings of that person's life. So really complicated phrasing, but it's essentially just like, say, the relationship between John's doctor and his family. So as mentioned before, a lot of perceptions around masculinity can impact people's willingness to engage in services. And a lot of the time, people, particularly men, will need a kind of encouragement from his wife and family to be more open and support them in knowing that they can have these struggles and it doesn't mean that they're, any less of a successful father or husband. So this is kind of just talking about how important it is that the people in your life and your support system kind of can become educated and aware of the difficulties that you might get when you have various illnesses and kind of be able to give you that support. And so the next system within Bronfenbrenners model is called the exosystem. And this is the third structure, and it contains the indirect social structures that surround an individual and their interactions with each other, such as societal institutions and mass media. So in the case study I was given for this essay, it said that John is regularly exposed to advertisements glorifying sugary treats. There's a lot of evidence to suggest that higher exposure to food advertisements can significantly correlate with food intake in adults and children, and also research to contend that exposure to advertisements can impact the behaviours and food choices of our children. So this might support the idea that mass media exposure has negatively impacted John's diet and food choices throughout his life, which can directly impact illnesses like diabetes. So people have also argued that low media literacy can impact an individual's ability to recognise that social media advertisements glorify negative health behaviours, so just unhealthy eating essentially. So there's a lot of evidence that certain people who aren't taught media literacy at a younger age are more susceptible to the influence of advertisements. It says that in the case study, John spends a lot of time watching television with adverts when he was younger, and as an adult, he still spends a lot of time on social media watching television. Which is influenced by the urban living environment, which again is, kind of an external factor that's outside of this person's control. Another example of the exosystem would be the impact of John's community and peer group. John reports a lack of trust in healthcare providers due to the negative attitudes within his community, as many people in his life has experienced inadequate levels of care at local doctors and hospitals. And again, as I mentioned earlier, there's a lot of evidence to support the idea that individuals are strongly influenced by the sentiments of their surrounding community and their peer group. Individuals living in lower socioeconomic areas are more likely to struggle with access to local resources, um, as well as those resources being adequately funded. Hospitals and doctors in lower socioeconomic areas have to deal with a higher number of patients, possibly worsening the quality of care further due to high service demand. These elements combined can really deter people in lower socioeconomic areas from trusting or engaging with services because of the attitudes that develop from this kind of long-term inadequate treatment that can arise in areas with health services that are underfunded. And so the next structure in the model is the macro system, which consists of the broader political, social, and cultural structures that one lives within. So this one I find particularly interesting, and it can really show the disparity between people who live in kind of more affluent areas and those more deprived areas. So John had minimal access to appropriate outdoor spaces that could facilitate regular habit development, physical activity as a child, having due to having lived in an urban environment. So basically what that's saying is that people who live in areas that are quite urban, that don't have a lot of green space, don't have adequate transport links to allow people to kind of get into the habit of doing those things, it can have really long-term impacts on how accessible exercise and kind of things are to people. We really put a lot of emphasis on individual responsibility of kind of being active and being healthy without really acknowledging all of the external factors that can really stop that from being accessible to the average person. So there's evidence that higher socioeconomic individuals with better access to neighborhood resources display lower rates of diabetes. In Bronfenbrenners model, this is a clear example of how the macro system has possibly impacted John's health behaviors, because living in a lower socioeconomic urban environment, it makes it practically difficult to regularly access the necessary resources for exercise. And also means that it's a lot easier to access fast food. There's a lot of evidence to show that lower socioeconomic areas have a much higher number of fast food restaurants per kind of area. So a lot of people also argue that this is a big factor. We can act like it's individual choice about if they're eating healthy or not, but if you're surrounded by fast food and takeaway shops where it's much cheaper and more accessible for you to access those than spending money on petrol to drive to your local M&S, which may be quite far away, or money on a bus which might not be adequately set up if you live in a rural area, etc., etc. And then the final kind of part of Bronfenbrenner's system is the chrono system, the final structure in his model. So this contains the long-term changes that occur across time. So this is a kind of a bit of a more confusing part of his model. He added it afterwards, but it's kind of just acknowledging how people and the world around people will change with certain things, such as like social media. So the invention of technology has had a really huge impact on people's lives. And this is kind of just the section that acknowledges those overarching changes in society. Yeah, so hopefully that was a useful kind of brief overview of Bronfenbrenner's ecological model. I really like it because it highlights the kind of contextual, external, and socioeconomic factors that can really influence someone's physical and mental health. And I think it's so important that we put more focus on these external factors, not in a deterministic way. You want people to feel like they have that ability to still have the free will to choose to do those things regardless, but it's really important that we take some of that personal responsibility off of the individual and we recognize better as a society all the external things outside of their control that can impact that, because it's really must be so frustrating for people who are struggling so much with various health problems, when people don't really acknowledge those external factors, because all of the responsibility and all of the kind of all of the focus is on that person's individual choices, which can create this false sense of that person failing or not being kind of quote unquote good enough, which is very harmful for mental health as well as physical health. A bit of a quick one today, guys. Not sure how this is going to go down. Obviously, it's been a really long time since I've uploaded anything, and this is kind of a new domain. So yeah, please let me know if this was helpful, interesting to you. Please comment any like thoughts or feedback. Obviously, I'm a very new channel, so it's very exciting when people do feedback. So do let me know if you have any thoughts, comments, and like I said, all of the references for this will be in the links below. Yeah. Okay. Thanks so much, guys. See you later.